Chapter 7, it is all about serious injuries, head and spinal injuries. Brain injuries includes bleeding, swelling, and concussion. For brain injuries, do this first. For the responsive victim, have the victim lie down, keep the victim still and protect from becoming chilled or overheated. Call 911 and monitor the victim's condition until help arrives. For unresponsive victim, check the victim's ABCs without moving the victim unless necessary. Control serious bleeding and cover any wounds with a dressing and call 911. Spinal injuries. A fracture of a neck or back is a spinal injury. For spinal injuries, do this. Assess the victim, stabilize the victim's head and neck in the position found, monitor the EBCs, send someone to call 911, reassure a responsive victim and tell him or her not to move, continue to monitor the ABCs until help arrives. The chest injuries. Serious injuries include broken ribs, object impaled in chest, and sucking chest wound in which air passes in and out of the chest cavity. For broken ribs, do this first. Have person sit in the position of earliest breathing, supports the ribs with pillow or soft padding, loose bandage over area and under the arm. Call 911, monitor the victim's breathing while waiting for help. The abdominal injuries. Abdominal injuries includes closed and open wounds that result from blow to the abdomen or the fall. Do this first. Carefully position the victim or his or her hand back and loose any tight clothing. Call 911. Treat the victims for shock and monitor the ABCs. Continue to monitor the victim's ABCs until help arrives. The pelvic injuries. A broken pelvis may cause severe internal bleeding and organ damage. For pelvic injuries, do this. Help the victim lie on his or her back and bend knees slightly if this eases the pain. Immobilize the victim's legs by padding within the legs and then call 911. Treat the victims for shock and monitor the ABCs. In Chapter 8, it is all about bone, joint, and muscle injuries. Injuries of the bones, joints, and muscles are among the most common injuries both at work and in home. Fracture. A fracture is a broken bone. The bone may be completely broken with the pieces separated, or it may be only cracked. For fracture, do this. Have the victim rest and immobilize the area. Second, call 911 or prepare for transport the victim depending on the seriousness of the injury. Third, put dressing on an open wound and control the bleeding. Fourth, apply ice or cold pack to the area. Then split the injury of the ambulance may be delayed or you are transporting the victim. Joint injuries. Injuries to joints includes dislocation and sprain. For dislocation, do this. Have victim rest and immobilize the area in the position in which you find it. Second, call 911 or prepare to transport the victim. Third, apply ice or cold pack to the area. Then splint the injury if the ambulance may be delayed or you are transporting the victim. For strains, do this. First, have the victim rest and immobilize the area in the position in which you find it. Second, apply ice or cold pack to the area, then a compression bandage. Third, support the joints with soft splint. Fourth, alleviate a sprained hand or ankle, then seek medical attention. Muscle injuries, strains. A strain is a tearing of muscle caused by overexerting or pulling of muscles. For strain, do this. First, rest the muscle. Second, put ice or cold pack on the area 30 minutes on, then at least 30 minutes off. With an extremity, wrap a compression bandage around the muscles, then alleviate the limb. Then seek medical attention if the pain is severe or persists. Cramps. A muscle cramp is a tightening of muscle, usually because of prolonged use. For cramps, do this. First, gently stretch out the muscle if possible. Then, massage the muscle. Then drink plenty of fluids. The RICE. The RICE acronym is an easy way to remember how to treat all bone, joint, and muscles injury. With this procedure, you don't not have to know whether the injury is a fracture, dislocation, sprain, or strain as they are treated in the same manner. R is for rest, I is for ice, C is for compression, and E is for alleviation. Types of splints. Splints can be made from different materials at hand. There are three types of splint: the rigid splint, the soft splint, and the anatomic splint. In Chapter 9, it is all about sudden illness. So, heart attack. Heart attack is a sudden reduced blood flow to the heart muscle. In heart attack, do this. First, call 911, then help the victim rest. Allow victim to take one aspirin, then monitor the victim's condition. Stroke. A stroke, also called a brain attack, it is an interruption of blood flow in a part of the brain. In stroke, do this. First, call 911, then monitor the victim, then position victim lying with head raised, then turn victim head to one side if needed. Respiratory distress, asthma. It is a common problem affecting 1 in 20 adults and 1 in 7 children. In asthma, do this. First, call 911 first unless victim has asthma medication, then help victim use inhaler, help victim rest until breathing is better, then repeat inhaler use if needed. Fainting. Fainting is caused by temporary reduced blood flow into the brain. In fainting, do this. First, check victims' ABCs. Second, lay victims down and raise legs. Then check for injuries. Then reassure recovering the victim. Seizure or convulsions result from a brain disturbance caused by many different conditions. In seizures, do this. First, prevent injury. Second, loose clothing to ease breathing. Third, turn victim on one side. Then reassure recovering victim. Diabetic emergencies. In low blood sugar, do this. First, confirm victim has diabetes, then give sugar, then repeat sugar in 15 minutes if needed. Diabetic emergencies, high blood sugar, do this. First, confirm victim has diabetes, then follow the healthcare provider instruction for hyperglycemia. Then, if unclear whether low or high blood sugar, give sugar. Call 911 if victim becomes unresponsive.